BCL-2 family of proteins has several members, including, of course, BCL-2 is one of the most represented in AML, but there are the other family members such as MCL-1 and BCLxL. There are a few others, but these are the key three. So MCL-1 is, as I mentioned, is one of the key mechanisms of resistance to Venetoclax, and so Venetoclax is a very selective BCL-2 inhibitor, which is great because we don't have to worry about much toxicities beyond BCL-2 inhibition, and the BCL-2 inhibition is only essentially toxic to the neutrophils, which is resulting in the mouse suppression and neutropenias, but it doesn't have any other toxicities. So the other family members, again, MCL-1, there are several MCL-1 inhibitors right now in the early stages of clinical trials. Unfortunately, so far, they all have encountered on-target, we think, toxicity, which we do not well understand yet. So the trials have been slow, but they're all still ongoing. So we're hoping that with the specific dose modifications and monitoring, we will be able to identify the dose and take it forward into clinical trials. So all of this is still very early, and we don't have any MCL-1 inhibitors approved for clinical use. So the other member is BCLxL. BCLxL is generally more important for solid tumors, not as much for leukemias. But our research has identified several subsets of acute myeloid leukemia where BCLxL might be important. For example, also based on the literature, patients who had a history of myeloproliferative diseases, they tend to have high levels of BCLxL, and they're not sensitive to Venetoclax. So for BCLxL, there was an agent that went into trials. It's called Venetoclax. It's also by AbbVie that made Venetoclax. Unfortunately, all BCLxL inhibitors have on-target side effect of thrombocytopenia, so low platelet count. And that makes it very difficult to use in the setting of acute leukemia patients who already have low platelets, so there's a high risk of bleeding. So right now, there are several next-generation inhibitors, dual BCL-2 BCLxL inhibitors. For example, AstraZeneca has a clinical trial with their dual BCL-2 inhibitors. Inhibitor that is optimized not to cause thrombocytopenia. It's in the early dose escalation phases. And then we have been very excited about the degrader. So there's a compound that leads to the degradation of BCLxL, not the inhibition. And it might be more beneficial because it's being degraded in tissues that, for example, tumor tissues, but not in the platelets, just by the nature of the degrading portion of this drug. So that is also in the early stages of dose escalation, but I think in the future we'll hopefully have the tools to work with, and we can perhaps combine those with Venetoclax. So these are the main players right now.